Okay, I recognize the member for Ancaster West, or Hamilton West, Ancaster Dundas.
Madam Speaker, I'm pleased to rise here to speak in support of this motion and particularly present the point of view from the people of Hamilton. You know, this government talks a lot about partnering with municipalities, and that is not how it's seen in the City of Hamilton. They recognize that this is a government that's just downloading costs, they're just dumping their costs on the City of Hamilton, and in fact, these are retroactive cuts that they're having to deal with. In the City of Hamilton, these are real cuts. This year, $2.4 million, and the next year it's $3.3 million from our public health care budget. And so they put the position of the city councillors that they have two choices. They can raise taxes or they can cut services. And we've heard time and time again that this government is not interested in consulting. No evidence that they listen to the people that are on the front lines. And you know, that is certainly how it's felt in the City of Hamilton. You know, I'd like to quote City Councillor Brad Clark, who actually served as a cabinet minister in two Conservative governments under Mike Harris and Ernie Eves. And City Councillor Brad Clark has this to say, and I quote, "He is very distressed by the absolute lack of consultation. All we hear is talking points from every member of this government. They are no longer listening to what our concerns are. This is not a dialogue, it's a sales job." And despite what Premier Ford says, the public health does more than put little stickers on restaurants. In Hamilton, public health provides services to our frontline in opioid crisis. They provide student nutrition programs. In fact, we've served over 35,000 children in about 120 schools in Hamilton, and I have volunteered in those programs, and every day I see the impact that that has had in the children in low-income neighbourhoods. You know, one of the things that the City of Hamilton Public Health was on the front line was a rabies outbreak. In 2015, Hamilton experienced the first confirmed case of raccoon strain rabies in southwestern Ontario. And so not only does public health rally around assessing and treating bites and scratches, they raised public awareness about the risk, and they also partnered with veterinarian clinics to allow families to afford to make sure that their pets were vaccinated. These are some very real things that the public health does in the City of Hamilton. And you know, we've heard about this remarkable statement that came from Ontario's big city mayors, and I'd just like to say that this letter is signed by the mayor from the City of Brantford, the mayor from the City of Burlington, the City of Hamilton. It's also signed by the mayor from the town of Oakville, the mayor from the town of Richmond Hill, and the mayor from the town of Whitby. So mayors that you represent are in disagreement with the cuts that you are making here to public health. You know, I just would like to say that you know, one of the things that is really disconcerting, and we've heard it time and time again, this is a government that thinks they have all the answers. They do not listen to people. And so we hear, not only are you not listening to the mayors of big cities and experts alike, you're not listening to doctors, you're not listening to nurses, you're not listening to frontline workers, emergency room doctors, you're certainly not listening to the medical officers of health. And I just would like to close by saying that the Minister of Health this morning made quite a callous argument when she said that she, and I quote, invites the medical officers of health to put money into actual public health priorities. And this is the kind of callous statement that people are offended by this government. Thank you.